At this Toronto supervised consumption site, a decline in opioid deaths in Canada doesn't tell the whole story. They've been helping a growing number of people avoid the worst.
We're running to alleys, stairwells, on the street, just running to respond to overdoses that are happening in public.
A new report says opioid toxicity deaths in the country decreased by 17% from 2023 to 2024. It points to several factors, including changes to the drug supply.
We know it's a very dynamic, unregulated supply. We know that new substances emerge and then they disappear for a while.
In BC, for example, there was less of the high-potency opioid carfentanil found in drug samples last year, potentially making the supply there less deadly.
While I'm really elated to see these reductions in overdose mortality, it's quite disappointing to me that 10, 15 years into this generation-defining public health crisis, we're relying on drug trafficking organizations to decide whether people live or die.
He and others say Canada needs a safe, regulated drug supply to save lives, because despite last year's overall decline, opioid toxicity still killed more than 7,000 people. And in Quebec, Newfoundland, and Northwest Territories, deaths went up.
Even though numbers may be decreasing Canada-wide, it's still an astronomically higher number than it was back in 2017.
Experts say another thing driving the overall decrease speaks to the scope of the crisis.
The people who are most likely to die are already dead, which is a very horrible and morbid thought.
In Toronto, the provincial government recently shut down 4 supervised consumption sites because they were within 200 meters of schools or daycares. Those remaining are scrambling.
People are just feeling really abandoned, feeling really disappointed that these services that they had relied upon are now gone.
The report also says so far in 2025, emergency calls and deaths linked to drug toxicity are once again climbing in some parts of the country. Alison Northcott, CBC News, Montreal.